Hi, my name is Bridget Page. I'm an academic advisor for Northern Virginia Community College at the Medical Education Campus. And I'm here today with Dr. Dugan, who's the director of the nursing program at Mary Washington. I'd like to thank you for coming today and giving us an overview of your program.
Well, thank you for inviting me, and I'm really excited to talk about the BSN program that we have at University of Mary Washington, particularly as it pertains to the BSN completion program.
Great, welcome.
So one element of the BSN completion program that most of you guys are very familiar with, it's for students who have already earned their RN degree from an accredited diploma or associate degree program. We accept students from any VCCS system school, and it will be a seamless transition.
Oh, that's good. Make it very easy for the students.
We do. So there are 10 courses that are part of the curriculum. These are at any university within the Commonwealth of Virginia, you have to take at least 25% of your classes at that institution to earn a degree. So since a total BSN is 120 credits at the University of Mary Washington, this is 30 credits. The classes range from 3 liberal arts classes, medical ethics, writing arts and healing, an upper level sociology or health science course, and then 7 nursing courses that range from intro to the profession of the nurse, all the way through research, and then of course your practicum.
All right, I have 2 questions. So a lot of our students tend to take biomedical ethics. So if they took that, would they have to take it again, or would you just have them take a different course to fulfill those 3 credits?
It doesn't transfer in as a substitution for that medical ethics course.
Okay.
So, and once again, so I usually advise students, if you plan on attending University of Mary Washington, not to take biomedical ethics. Or we can substitute it in as one of your humanities requirements or open elective requirements. So it does count as something, it just doesn't substitute in for that particular class.
Okay, that's good to know. And then the practicum, is that done on the job or is that separate?
Ideally, it's actually on the job, because one of the kind of facets of our program that's a little, what I think is interesting, is in 310, you identify a project on your unit or your place of employment, because I shouldn't say unit, a lot of us are seeing more nurses in the community, but you identify like a quality improvement project. So you'll identify that project and you'll put it in a PICO format, population, intervention, compared to, and then what your outcome is. In Nursing 410, you will actually do the research involved with that program. And then in 490, you'll implement it.
Oh, okay.
Yeah, so it's kind of neat. And one of the benefits,
that is neat.
what's kind of benefits our students as well is if you are on a clinical ladder or you are doing a new grad residency and you're required to do a QI project, we strongly encourage you to kind of have both of those align. And then that way you have the benefit of moving up the clinical ladder or completing your new grad residency project, your evidence-based project, as well as completing the requirements for your BSN. So I always say it's kind of like a 2-for-1 special.
That's good.
Now, we do have some general education requirements, and you're not required to have these courses done prior to beginning. And even if you do start at UMW, you're allowed to take, like we allow you to transfer in 90 credits. So if you start at UMW and you find that you need some open elective classes, you're still allowed to take them at your local community college to reduce cost of attendance, because we all understand college is expensive. But you need 6 credits of English, 12 credits of science, and that's usually fulfilled by the prereqs in the nursing program. 6 credits of social science. It can be sociology and psychology. One of those classes is developmental psych, which is a prereq, so you can take either sociology and psychology as well. Statistics. You do need to take a statistics class, and you have a few options. You can take the Math 155 Statistical Reasoning, or you could take Math 245 Statistics 1. Some students, and it really depends on kind of what your future goals are, some graduate level programs, and this is just anecdotal, seem like they like a true statistics, like that Math 245. So I always say, if you're going to go to the bedside and maybe be there for a year or two, and then you're thinking about transitioning, maybe to grad school, consider 245. We also offer statistics at UMW, a humanities elective, and we will take anything that worked for your associate degree program, and then 19 open elective credits. And you can fulfill those credits. If you're military, we take the prior service credits granted. If you choose to CLEP out of any credits, we'll take those as well. Or any open elective classes you've taken at NOVA will also transfer in.
So like nursing classes or no?
Nursing classes do not. Nursing classes
Okay.
come in, you get 41 credits in general credits for your nursing degree.
Okay.
So to apply, you are going to go to our website. We'd like for you to have a current RN license. It doesn't have to be in the state of Virginia, though most of our students do. We do need an official transcript from every single college you've attended. Okay, so even though you may have had those transcripts evaluated by NOVA, we need official transcripts because our registrar needs to evaluate them as well. We do, like most programs within the Commonwealth, require a minimum GPA, but let's be honest, 80 is passing in nursing school, so that's usually not a problem. Now, one thing that has changed this year is that we now allow students to start the program if once you graduate with your Associates of Science before you get your RN license, with the expectation that first semester you will get your RN license because that's a priority. Now, there is a way to get a jump start on some students, for some students, and this is actually a great option. There are 3 courses that students can take before they graduate. And this is maybe for somebody who's already done their pre-BSN work. They've already completed all the general education requirements. These courses are offered primarily during the summer. While it is an option to take them during the school year, I usually recommend that students focus on nursing school. Nursing school's hard. So your priority is to graduate nursing school. However, if you take them over the summer, it gives you a little bit of a jump start. And then also on your resume, it allows you to write that you've now begun work towards your BSN, which can be very attractive, particularly if you're looking at going to a facility that has a specialty unit you've got your eye on. It might make you a little bit more competitive. So once again, my contact information, I'm Dr. Janet Atarthy Dugan. Any questions can be directed to the BSN program at umw.edu. And we also have an admissions contact who is well-versed in the nursing program, Jose Torres. So if you use his email, he also has an office line and a text. I always recommend communicating via email. We can work with you and get you on board.
That's great. Thank you so much for giving us an overview and meeting with me today. And we appreciate it. And I know that that we'll have events where you'll be able to attend and talk to the students, but they can contact you if they want to do a one-on-one appointment or Mr. Torres, right?
Absolutely. And one thing I always encourage students, if you're not sure about your status as far as what classes you need, where you at as far as your prereqs or your general education classes, you can always shoot me an email and send me a PDF of your unofficial transcripts, and I'll plug them into a degree map so you know exactly where you stand and what classes you still need.
Oh, that's great. So thank you again, and we appreciate the time that you spent with us today.
Thank you for inviting me.
You're welcome.